Good evening, everyone. My name is Jackson Gregory. I'm a current sophomore here at Siena Heights University up in Adrian, Michigan. And what I'm going to be talking about today is the role of capitalism in the healthcare field in the modern day, and kind of what that looks like and what that means for normal people. So according to debt.org, nearly 41% of bankruptcies in 2022 were due to insurmountable medical debt. And this isn't necessarily a direct effect of capitalism taking shape in the healthcare field, but it's certainly something to be looked at when we're considering the effects of capitalism in healthcare and how that has kind of changed the way things operate from the provider perspective and from the patient perspective. So growing up with somebody who had two parents that were doctors, one is a surgeon, one is a pharmacist, I kind of got to see a couple different sides of this problem that we have, and kind of what that looks like for, especially with a pharmacist. You know, we have prescription drug issues and the opioid epidemic that has struck our country, and kind of what that looks like from a monetary standpoint for the providers. And my father, who's a surgeon, kind of dealing with the same thing, overprescribing pain medication. Not that's he doesn't do that, but a problem that his people in his profession have been faced with. And the outcome of treatment, and kind of trying to be transparent with prices and all that good stuff that I'm going to be getting into here shortly. What makes me really passionate about wanting to speak about this is, like I said, I've had a couple different perspectives within the medical field looking at this problem. So I have a couple different unique angles on it that I have personal experience with. I've also have extended shadowing experience and intern experience with a local emergency medical team in my hometown, and I got to see kind of the initial, right when we get there, the diagnosis of what the patient is dealing with, and all the medical stuff that comes with treatment and, you know, medicine in general, but also kind of seeing where things were priced at, looking at the monetary value of these services, and kind of just using my own critical thinking and thinking about how, you know, there has to be a way to make these services more affordable and more cheaper for everybody, really, regardless of insurance or not. And actually, insurance plays a big role in determining the price of most medical treatments, as I'm sure anybody who has had any sort of medical procedure or treatment done knows. And I'll be getting into that a little bit later here. And I'm going to be specifically comparing kind of, the United States healthcare model to a few other countries that are top ranked globally for their healthcare infrastructure, their healthcare campuses, and their services that they're able to provide, and their overall patient outcome and satisfaction. And so I'm going to be kind of comparing those two to maybe see where we can draw some solutions to help fix this problem that we've been faced with. So kind of how do we get here with healthcare and good healthcare being so unattainable for the common person in the United States? Ancillary is our whole problem of inflation that we've had with goods and services just in general going up over the past 5 or 6 years specifically. This doesn't necessarily go back to when insurance was started and got involved with medicine, which is around 1929, with Blue Cross Blue Shield becoming the first nonprofit insurance organization to provide medical health care to people in the United States. But how we got here is essentially, I apologize, I lost my train of thought. To make it kind of about money, where we're at, because that's ultimately the big issue that hospitals and providers are running into, because they're kind of just cogs in the system where that they maybe work for the system that is overcharging people and providing extreme price tags for life-saving procedures. And they don't necessarily align with wanting to do that to people, but it's just their occupation where they're at, but that's ancillary. But essentially, in 1929, when insurance came into play, back then, of course, because the insurance was just coming into play with our medical issues and bills, that it was a very new system. Since Blue Cross Blue Shield was the first company to actually pioneer this kind of new field that you could get into, being in insurance, there was not a ton of regulation with it, and it really was more I'm sorry, what am I looking for? A little bit more for the people, more necessarily. It wasn't about making a ton of money to benefit the owners of the insurance company. It's more about providing a service to people where they could be insured, not insured, they could be sure that if something were to happen to them or their family members, that they would be covered, and it would have to be one less thing that they would have to worry about. And over the years, we've developed to a point where these insurance companies are multi-billion-dollar companies who make all sorts of money, and unfortunately, that comes to the detriment of the common man and the person that needs these medical procedures and treatment that the insurance company is hiking the price up for. We can specifically see how this is kind of taken shape in the form of customer dissent with the recently incarcerated, Luigi Mangione, with him kind of taking a protest at these insurance companies and that whole case where, if you look into the details of the case, he left a lot of clues around the crime scene, kind of hinting at he didn't just assassinate this insurance company owner to assassinate him. He did it, and this isn't saying that I'm in support of Luigi's actions at all. It's just a retelling of the events that have happened. But he left all kinds of clues that hinted at he decided to take this person's life because he was very disappointed and had been personally affected by these insurance companies essentially taking advantage of people because we live in a capitalist society, unfortunately, and some people take that too far and just want to keep continuing to take and make more money, which is absolutely, you want to be a successful person in life and be able to not worry about very many things, but there's definitely an ethical line that whether they know it or not, a lot of CEOs of these big corporations more than likely cross to get where they're at, which is unfortunate, but that is the reality of kind of what we're dealing with now. But it's not all bad. There are certainly positives to our capitalist society influencing our healthcare. One of the biggest ones is that we do get very good quality care. Recently, the rate of graduates from nursing school has dropped from about 54% to about 39%. So we are seeing a decrease in providers, and that's something that will definitely continue to be an issue in the next 10 to 15 years as these older providers that have been in these hospitals and these private practices for a very long time are starting to retire and kind of hand over and pass the torch to these younger physicians who are going to have to live up to the precedent that these surgeons before them have provided. So our care is always very, very good. In general, even the smallest private practice, to a point, has enough resources and know-how to provide very good quality care for most patients. The main difference that I have personally seen between practice to practice would be bedside manner for sure. And there's actually been studies that pointed out that bedside manner can directly influence patient outcome and how they feel after their procedure. And I thought that was really interesting. But to go back to my point, great care is always something that you can expect from if you can get into a practice and you can afford their services, you're going to get great care and you're going to be taken care of. In addition to great care, you're always going to have cutting edge treatment. In the United States specifically, in addition to other countries, but specifically the United States, there's a very, very big sector of researchers and different medical professionals who are always looking into trying to find the next best treatment for, an ailment or a disease that we've come up short in treating or curing so far. And you can always count on that. A big part of a lot of hospitals actually these days is a research sector. And you look at very big hospitals like Wexley Medical Center in Columbus, a large part of their campus and a large amount of their revenue goes into developing research, and not developing research, but funding research to develop new cures and ailments cures and treatments for these different ailments. And so that's something you can always count on when you're going into healthcare in the United States specifically. But there are some drawbacks that I've touched on a little bit so far, but definitely come with the influence of capitalism in our medical field. And the biggest one that I've hinted on a lot so far is equity. Due in part, it's kind of a tandem here. So in part, with the insurance companies being privately owned and be trying to make money from their coverage plans that they put out for people to take advantage of. And these hospitals, a lot of time, being privately owned, and which is also an extremely large detriment to our healthcare system in general, which you'll find in other countries is not the case, and they have maybe different problems, but not as severe equity problems as we might have here in the United States. But there's a lot of people that cannot, just simply flat out cannot afford the treatment that they are supposed to be getting. And most times it's life-saving treatment. So if you look at the price of an open heart transplant, or open heart surgery, that can run you, the sticker price is usually around $800,000 to $1.2 million in total for all medical expenses surrounding that surgery. And that, for the very, very vast percent of American people, that is just unattainable and probably multiple lifetimes, especially given our economic situation, which is a whole different can of worms to open up. But there are things that can be done to make this these services vastly more equitable. But unfortunately, it kind of comes down to the people with the money that own the hospitals and that own these insurance companies. They are also in the they donate vast and generous amounts of money to political leaders and political campaigns. And this kind of gives these people that donate this vast amount of money leverage in these political policies, which will always kind of protect them and make sure that they're able to keep making as much money as they can, even if it is to the detriment of the common person. And another thing to go along with kind of, detriment to the common person is the deceiving that these insurance companies and hospitals utilize in an effort to make more money. Mark Cuban, who was a previous owner of the Dallas Mavericks NBA team, he's started a lot of businesses. He's invested in a lot of businesses. He was a shark on the TV show Shark Tank for a really long time. He's a very knowledgeable person about business and kind of what goes on and how to make a business successful. But I said all that to say, he started a company that I will get into in detail here in a little bit called costplusdrugs.com. And in part of starting this company, he called all the most notable hospitals in the United States and all his local area private practices, and he tried to get a cost estimate on a certain procedure. And he found that more than the majority of these hospitals could not even necessarily tell him what the price for a certain procedure would be. Now, in my father's private practice, we do have a sheet that lists out specifically and breaks down how much each procedure is going to cost, the things that go into the cost of each procedure, and the charge for that. But the truth is that most hospitals do not have this kind of transparency with their patients. Maybe not necessarily on purpose, but the common patient doesn't necessarily know to ask for that. And this is because this makes it so the insurance can basically name the price themselves, so they can determine how much they're actually going to be getting from a specific procedure. Then that goes through to the hospital, who just charges the patient whatever they deem to be appropriate to make the hospital money and to make the insurance company money. And the patient is not necessarily ever really considered in this this kind of triad here, which is very unfortunate. And so, like I mentioned earlier, most of these, all insurance companies are for profit in one way or another, and most hospitals are privately owned, which leads to leads to things being about money, which is unfortunate. But with the influence of a capitalist society like we live in today, that is just the reality, unfortunately. So to kind of go back to Cost Plus Drugs a little bit, Mark Cuban went in, he asked these hospitals what their prices would be for a certain procedure, and kind of using this response, he created a website, like I said, called costplusdrugs.com. And this website sells prescription medication. Legally, you need a prescription to get it, and it actually takes the price of the pill and it cuts out the middleman of insurance and hospitals, so where nobody is hiking up the price, and actually gives you the unit price for the pill since there's no hospital or insurance to have money be made off of it, this greatly reduces the prices of a lot of detrimental medications to a lot of patients. For example, a very common antidepressant on there called Wellbutrin XR. A prescription for that will normally, depending on your insurance, I have acquaintances who their insurance will run at about $75 a month for a month's supply. On this website, Cost Plus Drugs, for no added detriment or anything, you can get this same prescription for $6 a month. And this is simply just cutting out the insurance and allowing the drug to be priced for what it is and not necessarily have these premiums mounted onto it to make money for these various entities that are involved. And that's a really great thing that we as people need to continue to lobby for, is just transparency from these hospitals. Because the more we get prices on things, the more we get prices before it goes through insurance, after it goes through insurance, the hospital's general pricing, the more we can make informed decisions as patients and decide what really is going to be best for us. And I did a little bit of research into the country Sweden and their healthcare infrastructure, since it has been ranked #1 in the world in 2023. And a big thing with their structure is that all of their hospitals are owned by local municipalities and local councils. So these local councils get to create their own regulations using tax dollars from the citizens, and that's obviously a big thing, is that a lot of their healthcare comes from tax dollars. But if you look at the result in the data, and the average person in Sweden lives to be about 81 years old, and that is about a decade higher than the United States at this time. So if you look into it, it would pay dividends to get everybody on board for a healthcare system that would be vastly privately owned, where the people got a lot more choice in kind of determining where their tax dollars are going to go and how they're going to be utilized. So just to kind of sum everything up, it would be really good to get involved and send a letter or give a call to your local state representative and kind of get this topic on their mind. As I explained, it is going to be very difficult to kind of, in general, and you see this with a lot of policies these days, get enough say that we, the people, can kind of come together and have a greater voice than these politicians who are letting their money do the talking, or not politicians, these people who are donating to the politicians who are letting their money do the talking. But if we all come together, there's no way that we can be stopped. It's been shown time and time in American history over and over. When the people are united and have a common goal, there is absolutely nothing that can stop us. And so I encourage you to just continue to think about kind of how this affects you and how this affects the people you love and your friends. And just kind of think about maybe reaching out to somebody that can reach out to somebody that'll get this message heard and get it in front of the right people so that we can make some change action. Or not some change action, make some action and make some change. Thank you.